I know I'm gonna get some hate for this, hopefully not a lot, but I'm here to tell you that you need to ditch filler. Yes, I said it.
Hi, dermatologist here. I think filler has been getting a lot of hate recently. I've done a lot of videos on it, and I just think a lot of it is a misunderstanding. It's a misunderstanding, or I don't know who people have been going to get these procedures that aren't explaining things to them. Her profile says that she is a hospitalist. What a hospitalist is somebody who just does inpatient internal medicine. However, like looking at some of her videos, it seems like she's also doing cosmetic work on the side. Let's see what she has to say.
Guys, I read these MRI scans and CAT scans, and you can clearly see this filler in like these 70-year-old patients. My girl has no idea how long ago she's had that done.
You're reading MRIs and CTs? Okay, so let me get this straight. You're a hospitalist, but you also do cosmetic work, but now you're playing radiologist too. Sounded like jack of all trades, master of none. Yes, when you work in the hospital, you may look at your patient's scans, but they're going to have to be interpreted by a radiologist. And let me just tell you, most of the time, they are not looking for filler. Look, I'm a doctor and it's outside of my scope to read MRIs and CTs. There's been this plastic surgeon who's perpetuating this idea that HA filler like never goes away. Here's the truth of the matter. HA filler can last some time, in some cases years. However, it's going to depend on several different factors. One thing that's come out in the reports that are there is that there are some areas in the face where filler lasts longer than others. And people are going to talk about, oh, like filler migrates and it stays there for a long time and then it's going to migrate. What happens is if it's there long enough, your facial structures change. So as those things shift, the filler is going to shift too, most likely. I think a lot of this has been blown out of proportion because that specific plastic surgeon was in the literature describing several patients who had had a lot of work done, a lot of filler done, not your average patients. So I highly doubt that she is qualified to be jumping to these conclusions. And I feel like she's just repeating something that she's heard because it gets views.
Filler and Botox is quick and easy. It's very accessible to the public, and the risks are not benign. They're very serious. Who's to say this stuff is not breaking off and migrating? The filler can block blood flow, causing clots, which then can lead to blindness, strokes, tissue necrosis.
Let's talk about the risks of fillers and Botox. Botulinum toxin injection is the most commonly performed cosmetic procedure in the world. Filler injections are not far behind. Are there potentially serious risks with these procedures? Yes, they are medical procedures, so there will always be some sort of risk. However, there's also risk of like leaving your house in the morning. There's risk of getting in a car. Her point about like who's to say these fillers aren't breaking off? Breaking off to where? They are integrated into your tissue, so they stay put. She then goes on to talk about some vascular compromise that can happen with filler injection. That is not a delayed effect. Filler is not going to get into a vessel and cause tissue necrosis and blindness after somebody's had it for years. At least I've never heard of a case like that, and it makes no logical sense. Vascular occlusive events with filler tend to happen basically immediately. So most of the cases described happen within the first 48 hours. And basically what happens is that filler can be inadvertently injected into a vessel. If it's injected into a vessel, it blocks the blood flow downstream, and it's basically like a heart attack of the skin, some people call it. Vision disturbances and blindness, that's like a rarer but more serious potential side effect. There are some areas where the risk is higher than others. I've often talked about how I don't do filler injection into the nose because that's a high risk area for causing vision disturbances. One thing that she's not relaying is that these are not common adverse events and they are treatable. I talk to every single one of my filler patients about that being a possibility because I want them to know if anything seems off, they need to get medical treatment right away. That way perfusion can be restored and we avoid some bad adverse events.
We need to stop normalizing filler. and start encouraging more safer alternatives such as PRP. The slow and steady approach to anti-aging is the way. Consistency and, really putting all of that money you're investing in Botox filler, start to invest in PRP.
It's really random for her to just call out PRP as the replacement for Botox and filler. It seems to me like maybe that's something that she performs, that she wants to be a little bit more popular. I don't know. I don't know if she does Botox and filler also, but one thing that I've said about these practitioners that only have so much training and only know what they know is that when all you have is a hammer, everything looks like a nail. What is PRP for those of you who don't know? PRP stands for platelet rich plasma. It's a kind of versatile modality that could be used for medical reasons or for cosmetic reasons. The practitioner draws your blood. Blood is then spun in a centrifuge to separate it into different fractions, and they take a part of the blood called platelet-rich plasma, which is part of the blood plasma that has platelets but also has a lot of growth factors. That could then be used on the person, again, and cosmetically, it could be injected into certain areas. Some people really like it for injecting under the eye. Some people inject it around the face. And if you've ever seen the vampire facial, that's like a name for when you microneedle somebody and then afterwards you have all the little holes and you put the PRP over it. It can also be injected into the scalp to treat hair loss. Now, I am not saying that there's no place for PRP. However, it does not do what filler or Botox do. PRP will not revolumize the face. PRP will not get rid of hyperdynamic expression lines. PRP can be used for collagen induction. However, one of the main issues with PRP is that it's very difficult to standardize. The actual substance, the compounds that you're using to do this treatment are very dependent on the person. You're drawing somebody's blood, like they could have crappy blood volume. They could potentially not have a lot of growth factors. If the person is like not that healthy, you might not have as good a result as doing it on somebody else. So before we get up on the internet and start trying to use fear mongering to push people towards our own practice, maybe we should do the ethical thing and actually know what we're talking about.